Good afternoon, you're listening to Mainstream Mental Health Radio Show. I'm your host, Dr. John Huber, and today we are continuing with the ASKP conference, and we're blessed to have one of the original founders of ASKP, and right now she just finished up giving her presentation on that mystical or therapy, or the shamanic type experience that you may get with ketamine, and whether that's important or not. And at this point, I think I'll just turn that over to Dr. Prashad. Is that correct?
Yes,
okay.
Thanks for that introduction. So I'm Dr. Prashad. I have a private practice in Houston, Texas, where I have both a traditional psychiatry practice as well as a ketamine infusion practice. I'm one of the founding members and secretary of ASKP, and then I'm the founder and medical director of Houston Ketamine Therapeutics.
Okay. So what made you start or be part of the start of ASKP?
So when I was first learning about ketamine, I went to the Korea conference. This was 2 years ago in San Francisco that Raquel Bennett puts on, and I met a lot of these great people. And it was a much smaller group.
They are great.
And it was a much smaller group back then. And we started saying, Raquel is a psychologist, and she tells a lot about the psychedelic component and things like that. And we thought, there's a lot of data coming out with this, and we need a lot of this data to be talked about, and we need more of a medical conference, right? And I think there's still a role for both, but we certainly need that. And so we started to get together and said, let's discuss this and let's do this. And then what we wanted was a scientific conference, but then we also wanted to have an organization that promoted the best practices of ketamine, right? How do we deliver ketamine safely and effectively, and how do we promote those practices and have an organization that supports that? So we started so we have people from different coasts, East Coast, West Coast, in the middle, and so we started meeting by Skype at night, 7:30 at night in my time, 8:30 for Steve Levine, and we started looking into it, and so I contacted an attorney and said I want to start a nonprofit organization, and then we got the ball rolling.
Here we are.
And here we are, a year and a half later.
Wow. And I think it's very necessary. I think the psychotherapeutic, that mystical, is very essential in this, but at the same time, we got to have the science behind it.
Exactly, and that's why David and I did the presentation that we did. We wanted to say, that's great, right? One of my pet peeves is when people say, I had this one patient that, I don't want to talk about anecdotal evidence. Let's look at evidence,
Right.
Let's look at people who did studies. So that's exactly what we did. David and I reviewed the literature on looking at specific subscales and look at dissociation. Did they find patients who dissociated more tended to have a greater antidepressant response? And so going back a little bit to what Jason Wallach talked about, there are some similarities with underlying mechanism that's going on with depression and antidepressant response and that hallucinogenic experience.
Yes.
And so we wanted to look at the hard data. Is there data that supports this, right? Rather than just saying, hey, this is what I do.
Exactly.
So that's what we did.
So then you have your own ketamine clinic in Harris County, and so tell us a little bit about that.
So I'll tell you a little bit about how I got started. So I opened a private practice in Houston almost 8 years ago, and it was traditional medication management like we learn in residency and everything. And
safe
practice of,
Yes.
And I had a patient in particular who had been with me since the beginning of my practice. He initially came to me, he's an engineering student, really smart, had a lot of anxiety. Said, I'm going to quit school, I can't handle the anxiety, I can't do the group presentations, I need to just quit. I said, no, let's treat your anxiety. And I used, traditional antidepressants, some benzos, got him through school. When he finished school,
But it really didn't work.
No, it actually. So the story it gets better.
Okay.
So he actually got through school. He did well. He got a job. He had a supportive wife. He had pretty good. However, he became pretty depressed. It didn't seem like there was any particular stressor that led to that, but he became profoundly depressed. I used a lot of treatment-resistant depression has always been an interest of mine, so I'm pretty familiar with how to use complex augmentation strategies with medications to try to increase antidepressant response. And I tried a number of things: many antidepressants, complex augmentation strategies. We had him on 4 medications. I mean, it was like Seroquel, Lamictal, effects or something else.
Seen that many times.
Yeah, he had lots of side effects, was gaining weight, became profoundly suicidal. I sent him to the hospital, his wife was calling often, really worried about him. As a psychiatrist, we see suicidality often. There's some of those patients that really, it doesn't sit well with you, that you think, this is somebody who's really going to kill himself.
Right.
And this was that guy.
I know what you're talking
and
about.
Yes, and I thought, this guy's going to kill himself. And I'd heard of ketamine, and I'd seen some papers, and I actually had gone on vacation recently with somebody who was a dental anesthesiologist, and he was like, hey, Sandhya, why aren't you doing ketamine? And I was like, why am I not doing ketamine? And I thought about this guy, and I started looking into it. So I contacted Isabel Lagarda, who's here at the conference as well, and she has a clinic up in Boston. And I found her through this physician moms group actually on Facebook.
Really?
It's 70,000 physician moms. And,
wow.
And I typed in ketamine on there, and I saw she had a ketamine clinic, and I reached out to her, and she was gracious, and she said, come and I will teach you. I flew up to Boston, and I started to learn about ketamine. I still felt kind of scared to do an IV infusion, even though she had taught me. And so
psychiatrists don't usually do IVs.
Exactly. So I was like, I'm kind of scared. So then I delivered it intranasally.
Okay.
It cut
really?
Suicidality tremendously, and we got him a little bit more functional. However, it wasn't lasting, and I thought, this guy needs IV. There's some limitations with intranasal, right? You can't really get to that real dissociative experience exactly, and so on and so forth.
Very difficult.
It's different. And so I thought this guy needs IV. So Isabel had actually told me that, hey, there's going to be this Korea conference. Why don't you come? It's about to sell out. So I decided to go. So I went. I met some other people. They were like, we're going to teach you IV. So I went to another clinic, Enrique Abreu in Portland, and he really walked me through. And he said, hey, you're going to do the infusions. Put the IV in, mix it up, do it. And I just felt comfortable, and I went back and I started treating this guy, and it changed his life. He does really, really well now. So that was about 2 years ago. He runs every day. He's on one psychiatric medication. He's lost 30 pounds. He enjoys his life. It's been life-changing for him. And I started offering it to other patients, and the practice just grew and grew. And I have to also say, the career satisfaction that I've gotten from making that change has been profound for me. Obviously it's life-changing for the patients, but for me,
that's what we get into this for.
Absolutely, it's everything. Someone said last night, it's everything a physician wants. It feels very purposeful, right? It's amazing to be able to do the work.
Not only are they saying, hey, I feel better, but you see it, they're doing it, they're living a life.
It's not just this okay, I'm tolerating it.
Right, exactly.
Right? With antidepressants, sometimes it takes that edge off so that you can kind of tolerate.
And get through.
These people are
living life.
They're living life. They are exercising. They're enjoying themselves. They have no depressive symptoms, right? Something that we learn in psychiatry residency is that the goal of depression treatment really is to achieve remission, meaning little to no depression symptoms. That's something we so rarely achieve with traditional antidepressants. But with ketamine,
I agree 100%.
Right? But with ketamine, we see that often,
right.
and that's fantastic, right? You're truly changing people's lives. And I can only imagine the health benefits that are associated with all of a sudden you're running 5 days a week, your blood pressure is lower, you've lost 30 pounds, right? That translates into probably years of your life too.
So, you were here talking. What was your presentation?
Yeah, so David and I looked at the specific literature, and there's a number of subscales that some of these studies use. They were not designed to actually look at the experience that people have when they're undergoing ketamine infusion. So one is called the CADS, and it looks specifically at dissociation with dissociative disorders. It's an old scale. It has some overlap with what people experience during ketamine, but it's not quite perfect. And then another one is just looking at, it's called the BPRS, and it really is looking for more symptoms that people have during schizophrenia or psychotic episodes, which again is not really, it doesn't really mimic what we see during ketamine. So
that's more like what I see when I get a call, hey, you need to show up at the...
So exactly. And so we use these subscales in some of these studies to say, if patients had a CAD score, and a higher CAD score, did they have a better antidepressant response? And there certainly seems to be more rather than more evidence in that direction that shows yes. In fact, if you look at certain pieces of, say, the CADs, looking at deep personalization, so that's an out-of-body experience, feeling like you're looking at yourself from outside of your body, that those specific markers seem to be correlated to an antidepressant response. And so perhaps it's worth tailoring the treatment, and this is how I practice, which is where I adjust the dose to the patient. I think it's a way of really customizing the treatment to the patient, and then trying to get them to that point where we think there's a better antidepressant response, but also maybe that's a space in which they can do some self-exploration that has this sort of therapy benefit. And we see that often in patients who have either a history of trauma or something difficult they've dealt with in their life, and they're able to sort of process it through their experience with ketamine. I had an interesting patient that was in therapy, and after he did ketamine, he went back to his therapist, and she said, "You've done 2 years worth of therapy in 6 weeks. I mean, sorry, in 2 weeks, over 6 infusions, right? I mean, and so it can be really profound when people are able to achieve.
It's amazing.
It's amazing.
I mean, really jumped into this spring in my practice, and it is night and day. And I mean, I can't express to my peers out there when I'm telling them about this how, you know, they're like, wow, you seem almost manic. You're so excited about this.
Well, it's not just me, okay.
Right, it's not just you. And the thing is, it feels like we're part of a miracle.
Absolutely.
And the reality of it is, I mean, we just sat and talked about the science behind it. It's not a miracle, it's science. It's
science,
actually,
absolutely.
yes.
And you can tell from the energy in the room, right? People are excited about this. We are sold out. You know, we couldn't close registration down. We're sold out. There are
awesome.
people that want to know more about this treatment. They want to get their patients better. You know, this is profound and effective, and there is science behind it. And we need to look at that science. And again, we need to proceed cautiously, but I think this is exciting. One of the reasons I went into psychiatry was because I felt in my lifetime there would be great innovation. And it's starting earlier in my career than I would have thought, and I love it.
you can enjoy it now.
Yeah.
You know, and maybe, who knows, maybe 30 years from now they'll be talking about you and, hey, she helped start all this stuff and everything else. So,
It's exciting.
it is exciting. Well, Dr. Prashad, I'd like to thank you for coming on.
Thank you for your time.
And I appreciate you taking the time to do this. Hopefully this won't be the last time we talk. And you enjoy Austin. You only have a couple hours. I think you're all going to have some kind of board meeting here pretty soon. But,
yeah. And I went to undergrad here in Austin, so
really?
it's been a while.
Both of us actually went to Texas State undergraduate way back in the day. So
we won't date ourselves. Yeah.
No, definitely not. But thank you very much.
Having me.
You're welcome.